Here we're going to put together the full repair of the vagina and the perineum. Before you begin practicing repairs of the vaginal mucosa and perineum, it's important to recognize the angles at which you'll be suturing. The planes of the vaginal mucosa and perineum meet at a sharp right angle. They are perpendicular to one another, as represented on this foam block. The vagina is horizontal, the perineum is vertical. To begin our repair, we will start approximately 1 centimeter beyond the apex of the laceration. We'll start with an anchor stitch. Cut the short end. Along the vaginal mucosa, use the locked running stitch. After placing a couple stitches, you have the option to go ahead and check to see if you need any deep interrupted stitches. A note on these deep interrupteds. Some practitioners choose to stop at this point after having placed a couple of stitches to check and see if there is any dead space down beneath the stitches that they've placed. If you can still fit your finger into space, then there is dead space that still needs to be closed, indicating a less superficial repair that needs deep interrupteds. Some practitioners choose to do this deep interrupteds prior to beginning your running locked stitch. You will see both options in practice. For our purposes now, I don't need to place any deep interrupteds. However, if you did, either way, whether you place them beginning or at this point, you would leave your current strand of suture and pick up a new needle with new suture. And place your deep interrupteds in the horizontal plane going straight in and around rather than going down the vertical plane, which would risk running into the rectal mucosa. So your deep interrupteds would be inside the vaginal wall, the vaginal mucosa, running horizontally. And those would be interrupted stitches. At this point, I will simply continue our running stitch, our locked running stitch along the vaginal mucosa. The black line on the edge of the foam block represents the hymenal ring. At this point, I'll stop my locked running because I do not want to stitch into the outside near the introitus or the hymenal ring. I need to change the planes at which I am suturing at this point. In order not to place a stitch along the outside of the introitus or along the hymenal ring, I will enter in at the same side on the vaginal mucosa and come out along the inside of the perineal mucosa along the same side. This avoids any stitches or knots at the introitus or the hymenal ring. Now I'm ready to sew the perineum. And as I stitch the perineum, I will use the regular running stitch, which is not locked. I'll start at the top of the perineum and work my way down to the posterior apex of the laceration. We are within the submucosa of the perineum. From one side to the other. And this stitch is not locked. You can see the stitch comes straight across of the perineum. And there's the second stitch coming straight across the perineum. And one final stitch will bring me close to the apex of the perineal submucosa laceration. You can see these stitches running diagonally along the perineum. This is within the submucosa, not along the skin, and not the subcuticular layer, which we will do next. Once you've reached down to near the apex of the perineal laceration, we'll begin the subcuticular stitch, which will essentially zip up the skin of the perineum without ever having a stitch on the outside of the skin. So using our same suture, we will begin the subcuticular stitch. From the posterior apex of the laceration, we will begin the subcuticular stitch and work our way back up to the introitus. Remember, we don't want sutures or knots along the perineum or along the introitus, so everything we do will be hidden within. Depending on how close the apex of the laceration is to the rectum, you may or may not be able to work beyond the apex of the laceration, attempting to avoid stitching into the rectal mucosa. And one more stitch across, and I will be near the introitus. So at this point, I need to once again change planes from where I'm working, from the perineal subcuticular layer back up into the vaginal introitus. I'll enter in on the opposite side of the perineal submucosa and come out along the vaginal mucosa. And at this point, all I need to do is tie off my stitch. So I will take one stitch back across the vaginal laceration, And in order to tie off the stitch, I'll leave my loop on one side and tie off. Once your strand is so short, you may cut off the needle. Cut off both strands, and now the vaginal and perineal laceration is repaired.